Hi everyone, nice to see you again. Today is the first lecture of this course, Introduction to Counseling. As we know, this class is introductory level of course for the undergraduate student. And today we will talk about counselor's identity. So you are looking at the objective for particular this class. So let's think about one major question for today. What is the counseling? That will be a major counseling we want to explore for this class. So I listed three different objectives for lecture one. The first one, identify differences of guidance, counseling, and psychotherapy. We want to know what the counseling is. And one way to know counseling is to compare some other similar theoretical concept. We want to compare with guidance and psychotherapy. The second one is compare diverse mental health professionals. We want to know what the counselors are doing. This is another way to know the counseling by exploring some other professionals such as psychotherapists and social workers and psychiatrists, some other related helping professional. So that's the second objective for today. The third one, we want to know what would be a characteristics of good and effective counselors. I put down some example here on therapeutic alliance and empathy, genuineness, acceptance, and open-mindedness, and cognitive complexity, psychological adjustment, and competence. These are the characteristics of effective counselor, so we want to explore each concept. So we want to learn three different the major the things for today. Okay, the first one, I put down the subtitle, the Asian perspective. Well, when we look at the counseling and any other psychology, for example, if you look at the whole textbook that we are using for this class, all of the figures in the textbooks are Western people. And most theories are based on their perspective and their framework of thought. So it was interesting for me to look at these westernized theory from Asian perspective, like Korean. So I put down some Chinese letter to think this concept from different perspective. I hope this will help you to understand better. Let's think about the first one, the left side, the guidance. Let's take a look at here. Guidance is translated into these two words, jido. The first one, it means finger. And finger is pointing somewhere. So it is pretty kind of direction oriented. It's pretty directive. This is pointing to somewhere where we are supposed to go. We are seeking to arrive. And that is more value oriented. So, and this is another one. It means we lead someone else to get somewhere. So the whole concept of guidance is something, some value oriented and goal oriented. We want to take someone else to a certain place where we want to believe that someone has to go there. So, for example, this guidance is used a lot in school. For example, you have to cut your hair a certain level. You have to show a certain level of skirt. You have to do something. We have so many different principles that we believe that is the kind of ethics and morality in school. So that is more this side. And the other side, that is the different concept, is psychotherapy. if we look at the letter, it was translated into 치료. The first letter means the solving and fixing. It assumed that someone who wants to get help have some problem, and they are in the problematic situation. So we want to fix and solve the situation. And also the second letter, this means a kind of cure, some medical connotation. So cure and restoring from the deficiency and from the sickness. So the psychotherapy compared to the guidance based on some assumption that the person is sick, they have a problem, they are deficient of something. So we want to cure and fix something else. So do you see the difference? Two different opposite sides. If you look at the textbook on page 4, it is explaining the difference, all three concepts. On the left side, on the guidance, it explains short-term and modifying behavior and surface issue. And here and now and preventive, conscious, and focused on helper's suggestions for changes. For example, advice. This side, as a helper, we are giving some advice and suggestion to help and facilitate the situation. However, the psychotherapy is more in deep level. If you look at the textbook on page 4, the long-term and personality reconstruction and deep-seated issue, and there and then, so focus on past, and restorative, and unconsciousness even, and focus on development of help his ability to change. So, so we explore two concepts of this, and counseling that we want to know for today is exactly in the middle. Okay, and if you look at the letter that was translated as Chinese, is the first letter is together, and also it has another meaning is helping, and the second one is conversation and dialogue. So the counseling is something that we help other people by talking about their situation and problem. And it assumed that it's pretty equal relationship between counselor and client. We use the term client. The client is the person who seeks help. However, in psychotherapy, they prefer using the term patient. Okay, you see the difference. Patient is more, it sounds like more deep-seated problem and they are sick. But client is pretty neutral connotation. So as we look at this slide, we compare the counseling with guidance and psychotherapy. The counseling is more neutral, and it assumes that the client is able to be recovered by themselves. The counselor just help them to get better by talking with them. Okay, so I wanted to explore the definition of counseling by comparing with other two concepts. Is it clear for now? Okay, the second one. So we compared three different the concept in order to know what the counseling is. The second way to know the counseling is to compare some their professional. So if you look at here, these are the helping professional, the counselors that we are talking about today, and some other related helping professionals are there. The first one, art therapist. Art therapists focus on some creative tools to help other people. For example, they sometimes use music, and they sometimes use play, They sometimes use even movement to help other people. Psychoanalysis is pretty based on the Freud approach. So they analyze their past experience to reconstruct their personality. We will talk about that theoretical orientation later. Psychiatrist is a licensed physician. Okay, they are medical doctor. They usually diagnose the disorder and they prescribe the medication. And also psychologist is pretty comprehensive work. They are working in many different places. For example, they are working at the experimental lab. They are working even at school, like a school psychologist in United States. They are working at the rehabilitation service. They are working at the community center. So they are pretty comprehensive work, psychologist. And next one is psychotherapist. That is related psychotherapy that we just explored. It's more helping patient or sometimes even client by applying psychotherapy. It's more clinical experience and it focuses on some theoretical basis. And social worker, they also work in many different places and they stress some systemic approach. They try to help the helpee by providing a variety of approaches and intervention. And in particular, they try to help unprivileged people, for example, low socioeconomic status, the people, for example, like poor and old person. And it's pretty family-oriented and social system-oriented. So these are the some related helping professional, and counselor is one of the helping professional. And if you look at the left column of this slide, it shows different areas in counseling. So I put down some different one. The first one is school counseling. There are many school counselors, elementary through middle and high school, almost every school in the United States. And for example, for Korean, the Korean government just started the Korean school counselor from 2005. So the school counseling is one of the settings that they are working. The second one, marriage, couple, and family counseling or therapy. This one is also getting is growing because we know many family has serious issue like divorce and non-traditional family. So this is another area that it has some specialty. Community counseling, we know there are many the counseling center in our community, so they are working at there. And mental health counseling is more focused on their mental health issue. And college counseling. Even Ewha Women's University has a counseling center at the Student Union building. So the counselors who are working there, we can say they are doing some college counseling. Student affairs, they are handling so many student issues in university. For example, like 입학 사정관, a new profession in Korea. They're also related to counselor as well. And gerontological counseling is particularly for counseling the old and the people. So there are many diverse settings and professional even in counseling, and also some related other helping professional. So I wanted to introduce some other professional related to counseling. So we talked about the definition of counseling by comparing other concepts. We also looked at some other helping professional. The third one that we want to know for this lecture is to identify some characteristics of good and effective counselors. Let's think about your experience. Do you have any your counselor in your life. When I say counselor, it's not professional counselor. For example, good friend and good peer and or sibling or any other family member or your pastor even. Do you have any counselor? What are their characteristics? If you have someone who really helps you in many different ways, what are their characteristics? These are the answers for my question, and the textbook introduced several different characteristics, but I encourage you to develop your own answers to my question. What are their characteristics? Let's review the characteristics the textbook suggests. The first one is therapeutic alliance. Therapeutic alliance is the most important characteristic of the counselor. Therapeutic alliance sometimes is interchangeable with the term working alliance. So if we have a working relationship, is a reliable relationship, is therapeutic relationship, and that really helps other people to get better from the situation. So as I said, it's the most important factor in creating the client's change, and it exists through counseling, the whole counseling relationship. Usually the creating therapeutic relationship is important in the beginning of the counseling relationship. However, it's important not only in the beginning, but also throughout the whole session. And must deal with in some level of regardless of theoretical orientation. This means there are so many different counseling theories, psychoanalytic and person-centered and behavioral, cognitive. Even we are saying about like 400 different theories in counseling, but most theories stress the importance of therapeutic alliance, regardless of their different specific theories. So therapeutic alliance is number one characteristic of effective counselor. So they focus on how to make reliable relationship with the client. Without good relationship with the client, it's really hard to apply any specific techniques. So the relationship is number one. The second one is empathy. Empathy is the ability to think and to feel the other person's think and feel. So here, understand the inner world of the client. That is more cognitive perspective. It's perspective taking, I would say. So the cognitive component of the empathy is to think other person from their perspective. So we want to take their perspective. The second one is to feel the same way the clients feel. Do you see the difference? The first one is the kind of perspective taking from their perspective. The second one is we want to show that we are feeling the same way. It's more emotional arousal. It's not about thinking. It's not about understanding. It's more feeling and affection. So it is combined. The real empathy has two different components: is cognitive area and also emotional area. And both are characteristic and skills to learn. Some people believe that empathy is more some inner characteristic, some genetic they inherited from their parents. It's true. For example, if we estimate empathy level in terms of gender, usually female shows higher empathy than male. However, it also skills that we want to develop as a practice. So the empathy is a good characteristic of an effective counselor. So if we think about the person that really help us, and they usually show good empathic understanding. The third one is genuineness, is pretty authentic, open, and honest attitude. And based on genuineness, relationship, real relationship is founded based on that, and based on congruence. Well, congruence is a kind of psychological term. Congruent is perfect matching. Okay, for example, and triangle and circle is not congruent. However, if we have a same size of and same shape triangle, it is congruent. What that means? Well, when we interact with other people, we sometimes have a sense that they are saying something, but it looks like they are thinking different. For example, are you okay? And we could say, okay, I'm okay. But we have a sense that even though he's saying he's okay, but he doesn't look like he's okay. That is not congruent. So congruent attitude is authentic and perfect matching. So their verbal response and their non-verbal response is perfect matched. That is really show genuineness, and that cause to have a real relationship between counselor and client. For example, if we have really good and honest friend, they are very authentic, and they show congruence. They speak out. So the genuineness is another characteristic. Acceptance is to regard clients unconditionally despite difference. And unconditional positive regard is a term that Carl Rogers, we will talk about later. He's one of the major figures in counseling. He coined the term unconditional positive regard. What that means, when we meet someone else, we tend to see their condition. Is that right? When we see a client, we see their condition. I know you are showing poor academic grade. I know your behavior is not really good in the classroom. I know you have less support from the family. So when we look at a student, we tend to perceive a student from their condition. That really related this kind of preconception, some judgment. But we want to free from there. We want to see a person themselves. We want to see them without condition. That is something that we want to have as a counselor. So regard client unconditional means we want to see their inner characteristic without any preconception and judgment. And we also want to look at their positive and strengths and their resources rather than their problems and their deficiency something. So it is related open-mindedness, freedom from fixed preconception, not trying to convince the client of a certain kind of view. Because we also have a tendency to put our value on client. In particular, it is pretty a typical reaction of the teacher. Because teacher, if we compare teacher with the counselor, the teacher is pretty kind of value-oriented. They try to teach something. They try to instruct a certain value. But counselor is more natural. So they only help the client to get better. So from the counseling perspective, we don't want to put on a certain value from a counselor perspective. The next one is cognitive complexity. It's something that ability of seeing the client from multiple perspectives. When we look at a client, we need to look at the client's situation, for example, dual perspective. One is some inner perspective, their internal characteristics, psychological component. The second one, we also want to see some environmental influence on a person. So we want to see the situation from multiple perspectives, not only the inner perspective, but also some outside. So receive feedback and see different point of view. So that will be another characteristic of effective counselor. The last slide for today. Next characteristics of good counselor is psychological adjustment. It was interesting to know that about 62 to 84% of the helper have been in counseling, which means even counselors need help. They are the profession who provide the counseling service, but more than half of the counselors they have an experience of getting service, which means when we are healthy, we can help other people. So it stresses importance of counselor's psychological health. If we are sick, if we are in need of help, it's really hard to help the client. So we also want to maintain a good and healthy level of psychological adjustment. The final thing is competence is related to the professional ability. We want to know different technique. We want to be knowledgeable on different theories. So it's a crucial element for client success in counseling, and also the qualification and specialties. For example, most counseling program requires 48 semester hours in the United States and more than 30 credits in Korea. So that means we believe good counselor has a good competence in terms of their knowledge and skills. Okay, so we talked about the characteristics of the good and effective counselor from different perspectives. We talked about the therapeutic alliance. We talked about empathy, genuineness, and acceptance and open-mindedness, kind of attitude related. And also we talked about cognitive complexity, psychological adjustment, and competence. So today we talked about three different things. We wanted to know the definition of counseling by comparing other concepts and also other professionals. We also explored the characteristics of the good helper. As we are at the first lecture, I encourage you to be an active learner, because this lecture is only kind of overview and summarize the key points of each chapter. And I really encourage you to read the textbook carefully. If you have any question, please post your question to the cyber campus so that I can respond to your question. And if you look at even the textbook, each chapter had some additional questions. On page 25, the author suggests 3 different questions for you. So think about that question as well, every chapter. So I want you to be an active learner, not only just watching the lecture. Please be an active learner by watching, and also try to think about some other related question. If you want to know more, please go to the library and look for some information and look up the book and try to explore some information through the internet. Okay, so today we talked about the counselor's identity as the lecture number 1. We will talk about the history and some credential next session.